All right, well, let's get started. Welcome, everyone. I'm Jeff Pruitt from Quirk Healthcare, and today's presentation in our Insights webinar series is on EHNAC accreditation. The first thing I want to just talk about is just a brief introduction of EHNAC. They are the Electronic Healthcare Network Accreditation Commission, founded in 1993 as a federally recognized standards development organization, helping to improve transaction quality, operation efficiency, data security, and all kinds of other aspects to your data center and your IT structure in the healthcare setting. What they help you do is to improve your business processes with analysis of many different types of topics in their accreditation programs, as well as helping to make sure that you're compliant with regulatory and state and federal regulations and rules. Now, the benefits to the EHNAC accreditation, you can see here, there's quite a few of them, but basically they're demonstrating you're demonstrating your adherence to the higher standards that are proven in these programs. The quality, the privacy, the security, the confidentiality, data management, data center, all kinds of different aspects to your data center as well, not just how your servers are configured or how they're managed, but also physical aspects to them, such as like alarm systems and monitoring systems, and how are your data centers labeled? Are they easily recognized or are they easily accessed? Where they help to ensure compliance with HIPAA and state regulations, like I've just said. They help you remain competitive because these technologies are changing so quickly. These help you ensure that you're using up-to-date technologies, that you're using up-to-date processes, and that you're constantly looking at these things with regular processes for improvement. The EHNAC programs work with many of the industry standards, NCPDP, HL7 for a couple examples. They also encourage improvements in your products, your service, your workflow, greater efficiency through reduction in business processes. Like I said, reevaluation on a constant basis, or at least a regular basis, of your business aspects and your risk assessments. And providing a comprehensive assessment of all of these different things that you'll look at in your evaluation. Now, I'm going to go through a basic idea of the accreditation process. This applies generally to all their programs. And then once we get through that, we're going to take a look in more depth at their MSO accreditation program and all of the processes that go into that. Now, many of the other programs that they have are very similar and have some, but still have some differences in the specific aspects that they're looking for. So the accreditation process starts with submitting an online form for pre-application. This is just identification of your organization and what you're looking to accredit for. Once you've submitted your application and EHNAC organization has received your signed agreement and such, they will mail back to you their thoughts on what you're eligible for and what you need to do to accredit for each of those programs. Next, you'll mail an application fee. Now, the application fee is based on your organization's revenue and the number of programs you're applying for. It's not just a straight, linear scale. They do, kind of discount things a little bit, the more programs you apply for. Once all that's received by EHNAC, they will send you a self-assessment package. When you receive that, you have 8 months to complete it. And then, like I say here, you have to return it within 4 months of the expiration date. That means that your entire process is a 1-year process. You've got 8 months to fill it out. Once you get it back to them, then they have 4 months to complete the process. Now, one of the things that I feel the need to warn everyone about here is just that they are very strict about their fees, and that you get things in on time. I have worked with a couple practices, and fortunately none of them here, none of them that I've worked with were assessing late fees or penalties, but it's very prominently displayed, so to speak, that this will happen if you are late. So fees are added each month that your package is late beyond your 8-month timeline. Again, the fee is based on your revenue. And late submissions can mean that penalties from being removed from EHNAC's website until payment is received to needing to restart the entire application process. Now, what it means to be removed from their website is that when you put in your application that you want to go for accreditation, they update their website and show you and your organization's logo with a little bit of detail saying, yes, you're going for this program and that you're in your process, or that you're in this stage of the work through it. And so if you're assessed with late fees, they might take your name off of there until they receive it. Next part of the process is that you have to go through these 8 months of looking down through all of their many topics and many different aspects of your organization and coming up with documentation on each of these items. Compile all of this information together, write it up, forward it around to your organization, whoever you need to really, to make sure that you get as much detail as possible. Once you submit that, EHNAC is going to review that and then schedule a site visit. Now, a site visit is just their way of coming out and making sure that you aren't just making things up. They're going to come out, look at your documentation that you've provided, and then go through their checklist and say, well, yep, they did that, they did that, they did that. At the end of the site visit, they're going to provide a site visit summary. Now, this is a document that details everything that they've gone through, what they've seen, what they feel is missing, what they feel you've done well on, anything like that. And they're also going to conduct an exit interview of sorts. This can be with anyone in your organization, whether it's the folks who actually produce the documentation, or whether it's with a VP of IT or with the CEO. Doesn't matter. They just want to talk to people about how this was done, what your organization is doing, what it's thinking about doing in the future. Anything like that will help them review and get to know your site and what it's capable of, what you're looking at, and that's going to help in their review process. After the site visit is complete, there's also a payment of site visit fees. Again, this is based on revenue of your organization and how many sites you have. Once that's all in, there's an approval process for the site visit report, a back and forth of reviewing their process, amending it to include details that they left out or that they misquoted, anything like that. Then the EHNAC Commission is going to review all of that documentation, the site report, the site visit summary, all of that, and vote on it to approve or deny your accreditation for that program. It's a majority rule in the approval or denial. There's no need for a unanimous vote from them. Once you are approved and are accredited, it's in effect for 2 years, and at the end of that 2 years, then you'll need to go through the process again. Okay, who can be accredited? There's many different programs that they have, and so there's many different types of organizations that can accredit. You can have your electronic health networks, e-prescribing networks, third-party networks and administrators, financial service organizations, MSOs, billers, HIEs, ACOs. HISPs is one of the new ones that they're working with to help get accredited, and also practice management systems and outsourcers. And now here's a summary of their different types of programs. Now these are just the overall topics. Each one of these programs has many different subcategories depending on what type of organization you are and what type of accreditation you're looking for. So here again you can see that we have an accountable care accreditation program, direct trust agency or agent programs, e-prescribing accreditation programs, e-prescribing of controlled substance programs, financial service accreditation programs, HIE programs, HNIP programs, the MSOAP for MSOs, which we'll be talking more about here in just a moment, and the last one, the Outsourced Services Accreditation Program, covers many, many other different organizations, as you can see here. Okay, let's look at an MSOAP overview. Their documentation or their categorization of this is broken into 8 different sections. We're going to look at each section and get an idea of what they're looking for in these sections and what you need to provide in each of these sections. Now, a couple warnings here. Just when you're going through your documentation process, that 8-month review, it's tempting to kind of go overboard and say, well, I'm not really sure what I need to put in this category. So I'm going to put a little bit of this, a little bit of this, a little bit of this over here, because that seems to, cover all of my bases. But that's not what EHNAC is looking for. They really want to know that you have looked at their topics, that you have studied them, and have, talked about it with your, EHNAC advisor, or that you've talked about it, on their forums, that sort of thing, and really come to some sort of conclusion about what they're getting at here. So you want to provide as specific information as possible for each of these topics. Okay. Now our first section that they have is the introduction to the environment. This is a very high-level look at your data center and your sites. What they're looking for you to provide is things like data center diagrams, server diagrams, data flow diagrams. This server is passing to this server, or this server passes through an interface to this location, anything like that. They're also looking for how you connect to your individual sites. So maybe you're in a hospital environment and you have 2 sites that are within the main hospital building and they just have a direct data connection, but there's 2 other sites that are down the road and they connect through a secure data connection that way, or even that they connect maybe through just a generic internet connection and have security established on that. The next topic is qualifying events. This covers an overview of the actual EHR software. What they're looking for is what software you're using, the versions, what third-party software you're using, what different options you're using, whether you're using interfaces, what interfaces you're using, what HIEs you're using. And in addition to that, what type of IT personnel you have, a little bit of the makeup of your IT department, and a general idea of the work location of IT in relation to things like the data server. Now we're starting to get into more detail. Privacy and confidentiality topic. They're looking here for more detail about specific policies that your organization has. In particular here, they're looking for privacy, security, handling of PHI, auditing of PHI, auditing of your users, any breaches, how you report breaches, who you report your breaches to, password management, encryption, decryption, malicious software, anything like that as well. And they're also looking for things like project management plans, installation plans, maintenance plans, anything like that. Okay, our next topic is technical performance. This details many aspects of the servers themselves and some of the software you're using. So the primary one you see here is proof of Helpdesk software in use. Now, in previous years, EHNAC would allow you a little bit of leeway here and say, as long as you have some sort of documentation of your IT department keeping track of issues and their resolution, you could get away with it, and they weren't too picky about it. Now they're starting to get a little bit more picky about that, and that they are looking in some of their programs for specific help desk software, not just that you're keeping track of it, say, in an Excel spreadsheet. But they're also looking here in this topic for things on policies of your service level agreements, how problems are escalated, your corporate policies on system availability and redundancy and help desk availability. Specifically there, they're looking to make sure that based on all of your practices hours and such, do you have help desk to cover them? So, if your help desk is typically available 8 to 5 weekdays, but you have a practice that is open on Saturdays as well, they might kind of frown on that sort of thing. Anyway, downtime procedures. Also looking for how you handle those. Are there specific processes and policies for your IT department to contact the practices and the users if there's a system outage? Things like system monitoring, backups, expansion policies, proof of backup and restore testing is a very big one that they're looking for. Again, we get into some of the PHI policies, things about firewalls, VPN, bandwidth, and also risk assessments. Our next topic is business practices. Now, these are more to do with your organization internally and how you relate to other businesses. So things like business agreements with your partners, privacy agreements, service level attainment proof, employee handbooks even, mission statements related to how your organization works with all of your providers and users and keeps them up and running. Our next topic is resources. Now, this is a very broad category for hardware, software, and also your personnel. They're looking at things like specific hardware and software inventories, more detailed than what we gave in our first category about sites. So in this one, we're looking typically for specifics about, say, site 1 is primary care and internal medicine. Site 2 is oncology and ENT, and more detail about how the software is used within each of those locations, if there's differences. We're also looking in this category for things like data storage reports, again, service level agreements, but we're also looking for things like brief bios or resumes of your key personnel in IT and how they interact with all of these locations. What kind of continuing education processes you have, what kind of security systems you have. Like I mentioned earlier, things like fire extinguishers, monitoring systems for the data center, what kind of redundancy you have between your data centers, and also a general cleanliness of your data center. Is it cleaned on a regular basis, or is it reliant upon a janitor being let into there like once a month or something? The next topic is security. Now this one really goes into some fine detail. Again, compliance with federal and state security rules, auditing and assessment of PHI risks, policies for enforcement of security, how do you deal with access requests and the withdrawal of such access after it's given? How do you respond to emergencies, both natural disasters and also things like system outages, even maybe more of a personal nature that someone has broken into the data center? How would you handle such things, or how would you deal with someone breaking into the system and hacking into it? What sort of prevention and notification do you have? What sort of emergency access processes do you have? So say that data gets subpoenaed. How are you, giving quick access to the reviewers who are coming to look at this information? And finally, our operations category is dealing with your organization and how you practice overall. Adoption of new plans for providers and practices to the organization, plans for your EHR in the future and its functionality. Hardware assessments, how do you go about them? How do you go about hardware assessments as well for new organizations and new providers that are joining your organization? So is it a matter of that the practice themselves have to review hardware and purchase hardware, or do hardware and such purchases go through the IT department and then get pushed out to these practices? Customization of the system is also looked at here. Do you have a strict policy that software is used out of the box? Do you have any customization of these, or are there specific options that practices and users can subscribe to for working with their system? What kind of training documentation do you provide? Does training go through the practices and say a super user model, or is there a specific training group in your IT department that handles all of that sort of thing? Again, and in relation to that as well, training of users on incentive programs, meaningful use, PCMH, anything like those, HIPAA compliance. And finally, an annual provider satisfaction survey. This is another big one that they've been looking for in the last couple of years, that not only are you doing all these things, but we want to know, get some feedback from your providers that you are, on how you are doing. Not specifically that you're doing well, but that you are doing something, whether it is good or bad. And again, once you get all this compiled, that's the point where you'll detail it all, document it all, compile it into a nice big package, and send it off to EHNAC for their review and their site visit. That's all I have today. Does anyone have any questions? Okay, well, thank you everyone for attending, and hope to see you back for more insights in the future.